like I said, I always try to express my appreciation, to everybody. It's a lot of people that
perspective. Real empowerment, you better be respected. Lady Fresh on that motherfucking check-in. Breezy got her back, she stay protected. This the fresh perspective. Real empowerment, you better be respected. This for the dreamers, it's to get you through the night now. Not for the haters, bet you they don't come outside.
Lady Fresh Brown, and that's just kind of started from there. That's awesome. So can you tell us the actual definition of autism?
Well, it's a neurodevelopmental disorder, but kind of the current thinking is that it's not really a disorder, it's a difference. But we go by this medical model in the United States that says, just like any medical issue, you have to meet certain criteria to get that diagnosis. So it's hard. It's a difference in the way we socialize. So what we call neurotypical brain versus an autistic brain, they socialize differently. They understand social interactions differently. And when a child is growing up, that's something that can be very apparent in some autistic children, is they don't really show an interest in peers, or they may be interested in peers, but they don't really know how to interact. So their brains just grow in a different way as far as just being social and interacting socially. And then there's often a communication difference. There's some types of autism, it used to be called Asperger's, which is not used anymore. Those kids come out very verbal very early. And they're often referred to as little adults because they have sophisticated language. But more common, I would say, is that there's a delay in language. And so
I'm going to go ahead and start introducing our panel. First, I'm going to be bringing up Miss Cali. Miss Cali is an up-and-coming content creator. I actually met her in several chats, most recently on Miss Parker, who is a huge supporter of the Fresh Perspective. She's often around a lot of different panels, so we get a chance to see each other in passing, but when I told her I was going to be doing this show, she was totally on board with being here today. So you guys, please welcome Miss Cali.
Hi, good morning, everybody. Good morning, Lady Fresh.
I love that picture, girl.
Thank you.
It's a beautiful picture. So how you doing this morning?
I'm feeling better this morning. I'm doing okay.
Yeah, okay. That's good. That's good. So before I bring up our next guest, I just wanted you to introduce yourself to everyone and, just tell them a little bit about your journey as far as, your son, and what's going on there.
Okay. Well, hey, you guys. I'm Miss Cali. As she stated, I am an upcoming content creator, still fairly new to it. This topic touched me when I heard she was going to do it because like very, very recently, like literally last month, I found out my son was autistic. I knew the signs, to be honest. I just was having a little bit of trouble with getting the doctor to be on the same page, but I'll go into detail with that a little later. He is 3 years old. He'll be 4 in July. He is low spectrum, so it's not high. And then I'll give a little bit more detail further in the show.
Okay. So you guys, I am going to actually bring up our next guest, Dr. Emi Hosoda. And she's speaking to us as well as a parent, but she is a doctor. She works in a different field, and we'll get into that a little later as well. But she actually has a lot of experience in raising a child on the autism spectrum. And so I thought this would be a really great pairing today, because that way you would be able to see someone who has lived it and dealt with it for, I want to say, close to 20 years. And then someone who is just finding out and getting the shock of the diagnosis. So hopefully, we can have both of these ladies tell their stories, and maybe Dr. Emi will be some kind of resource and encouragement for Miss Cali in her journey. So you guys, welcome Dr. Emi to the show.
Hi, it's so nice to be here. Thank you for having me.
So glad you were able to be here this morning.
Yeah, I am too. And, I'm here as a parent because, of course, my specialty is actually weight loss and anti-aging. But it's been an interesting journey being a doctor and then having a child on the autism spectrum, and just seeing the medical system and, the things that I had to do sort of outside of that. So that's been very interesting.
I can only imagine. And so I know that your son is older.
Mm-hmm.
So,
Yes.
and I can only imagine that things are different today, getting a diagnosis versus maybe getting a diagnosis 20 years ago. So can you tell us what were some of the signs that you may have picked up on your son, as an adolescent? I'm not sure how old he was when he was diagnosed.
So he was diagnosed around age 5, but things had been going awry for us for about 2 years before that. So, he was born pretty normally. I had a C-section because I'd had a C-section before. He was small, but really nothing else was unhealthy about him. We took him home and he was developing normally. I was working as a resident. So I was working, kind of 24/7, getting my training as a physician at the time. And so he was mostly home with our nanny, and my husband worked also. So our nanny spoke Spanish primarily, and so we were in Texas at the time. And then he was about 2 when we moved to Washington State. And we made the drive and everything and came, and we noticed that he sort of stopped speaking. And we thought that maybe it was just because we had switched him from Spanish to English and he was having a hard time with that. But it ended up being deeper than that, because after that, he started to get a lot of behaviors. He started to roll on the floor and scream. He, would tell my husband to draw things, but he couldn't pick up a pen and draw things at all, even though you could tell like he was imagining things. He was like instructing my husband to draw things for him, but he could not do it. His verbal skills were very limited, just 1 and 2 word sentences up until about the time he was like 5 or 6. He barely spoke. So, we knew things were wrong. And he was also quite ill. So he had like a lot of allergies and sinus symptoms and gut issues and bowel problems. And, when we took him to the doctor, we just didn't get a lot of answers. And we also took him to what's called the developmental pediatrician. So they're pediatricians who are supposed to deal with kids who have these abnormal behaviors. And they really couldn't give us much of a diagnosis at first. So they were like, well, he could have bipolar disorder, but he's too young for us to tell that. He could have schizophrenia, but he's too young for us to tell that. And he could have something called pervasive developmental delay. But no one ever used the word autism in the first few years. So we were just very, he went through a battery of psychological tests and everything like that. And then, he was identified as a kid who had issues. So we enrolled him in this preschool with the school district. And one of his teachers was like, well, you really need to take him to this doctor who's about an hour away. The doctor didn't take any insurance at all. So we had to pay everything cash at the time. And I was a young doctor, new in practice. So it was very difficult. But he was considered the best. So we took my son there. And he actually diagnosed him. He said he has, a variant of something on the autism spectrum. But he didn't really give us anything we could do for his behavior. He told us that he could run an EKG and give him a medication to calm him down, which required doing an EKG because it could potentially cause heart issues. And I was like, well, he's 5. I really don't want to put him on anything like that. Is there anything I can do to change his neurologic destiny? And the doctor told me, no, there's nothing that you can do. And that's that you can just calm him down. But he did give us some really good tips on how to deal with him. So some of the good tips he gave us was never raise your voice. So what he said was, your son, when you raise your voice, all he can hear is the voice because they're very sensitive to sound.
Mhm.
So he said, you really need to keep your voice very even when you speak to him. Always keep it like very dispassionate so that he can actually hear your words, because if you inflect your voice too much, he's not going to really hear what you're saying. And that ended up being a very useful tip. And then the other thing he told us was people on the autism spectrum have issues with reality. And so you need to make sure that he's very grounded in reality. Don't let him watch television. So when he was little, when he was with the nanny, he was watching like Teletubbies and all this television. He said all of that makes his symptoms worse. No television, no video games, get him outside in nature. These are not your babysitters. So my husband actually quit his job. He was working for a company that made video games that actually went really, like if he'd stayed there, we probably would have had tens of millions of dollars.
Oh,
But
wow.
he had to quit the job. It was called Valve. He was working there as one of the people doing the video games. And so he had to quit and stay home with my son, because my son at this point required somebody to like be with him and really, take him out in nature, make sure that he had all the right, therapy sessions and all of that. So it was quite a huge sacrifice for us from a lifestyle perspective, because now we're down to one income, and we basically had to go that way. But in retrospect, we would have done the same thing. My husband always says I would have done the same thing, because now we have a kid who functions rather than a kid who doesn't. So it was worth it to us, but it was certainly talking about it. I mean, I've never really talked about it in such detail, and it really was very stark for us. And we had an older child who basically, when you have a kid who has so many needs, the other children a lot of times don't get a lot of attention. And so he didn't. I mean, he kind of had to be, on the sideline of whatever we had to do with our kid who needed more.
Wow. That's a lot. And I mean, I commend you for recognizing what your child needed and what was best for your child, having to go down to, a parent staying home, not working, and, committing full time. I mean, I can only imagine what that was. And you being a young, like you said, you were either fresh out of med school or it's just starting
First as a residency.
as a residency.
So I just started my practice. Yeah. Mm-hmm.
Okay. And so Miss Cali, did you experience any of those similarities as far as identifying some of the behaviors in your son early on?
Well, at first, of course, originally I realized he wasn't talking. And then, so he is in speech therapy. She'll actually be here at 11. He's in speech therapy. He screams a lot, like a lot.
Mm-hmm. Yeah, my son did too.
It's to the point where it like would break me down, because I don't know, because he still does it what he wants. I try to give him stuff, try to calm him down, and he just screams a lot.
Yeah.
So that was one of the things I'm like, to me, I guess, I'm not going to say he's not normal, but I was like, I questioned, let the doctor know, because I was not understanding just why he would scream instead of saying anything.
Yeah. I mean, they can't communicate, so that's kind of their way of communicating. And that was very much like how my son communicated, rolling on the floor and screaming when things were not going his way. So, or, if he wanted something and we didn't understand what it was. But,
so yesterday we discussed a lot of like the different traits that
mm-hmm.
children would show, and it caused parents to inquire. Do you think that for one reason or another, like in Miss Cali's situation, the pediatrician didn't pick anything up? Do you think it's necessary for a specialist, or should the regular pediatrician be able to say, hey, he's not hitting these milestones, he's not doing this yet, maybe we need to look deeper? Because that seems like a problem to me.
Yeah, I think that is a problem. I think there needs to be a lot more education for general pediatricians, people who are on the front lines of primary care, to be able to pick this up, because they should be able to really. And also in school. I mean, one of the big problems we faced was the first teacher that my son had, like the first 5 years in elementary, really did not understand the autism spectrum at all. And they actually had an autism specialist in the district. And she would call me with like behaviors. And I was like, but you're a special ed teacher. Like, just put him in a dark room, give him a weighted blanket. Like, his behaviors had improved a lot by then, but he would just freak out once in a while. I was like, why don't you know what to do with this? Like, this is your specialty. You're a teacher in special ed. So yeah, I think there's just a lack of understanding, both in people who don't specialize in it in primary care. So, what I would hope is that a primary care doc or a pediatrician would be like, yeah, I see that there's some differences. I will send you to a specialist to, maybe make the diagnosis, like a developmental pediatrician. But people should be able to, I think, in primary care, recognize, these basic things that are going on with kids not hitting milestones, speech delay, behaviors, and I think it is kind of disappointing that, someone like Callie has had to like point out to her pediatrician over and over that things are not good.
Not right. Right. Yeah. I don't know. For some reason, just in all the research that I've been doing, it just seems that is a common theme these days.
It's a common theme. Yeah. And also what to do is not really known in the general medical community, unfortunately. So, I'll tell you guys a little bit about my own story, but it really took me outside of being just the regular doc in a lot of ways, because it showed me that there's so little for these kids in general medicine, most unfortunately.
And
so they almost always have to see a specialist.
A specialist, but also I would say somebody who's maybe more holistic. So what happened to us was I actually got invited by accident just because I had a reputation. I mean, I was just a regular internal medicine doc at the time, but I had a reputation for being more open to holistic care. Like, I would refer to chiropractors or acupuncturists if a patient had issues that I didn't want to use a lot of medications and all that. And so these parents heard about me. They had a group called the Dan Doctors of Autism. The Dan group, Defeat Autism Now, but they had these doctors that were working with them. And so they invited me to a dinner where a doctor was giving a talk about nutritional approaches to autism. And I had never heard a single word from anybody about the fact that this could be nutritionally approached, And in my own mind, I mean, I was just a regular doc at the time. So my mind did not go there. Because that's not how we're trained as doctors. We're not trained to talk about nutrition really, or lifestyle very much. And what they talked about was the fact that you could change diets for these kids. So what they recommended was going off gluten, dairy, artificial color and flavor, and refined sugar, getting allergy and sensitivity tested. So I did those for my son, and I took him off those foods. And lo and behold, not only did like his allergies get so much better, his bowel issues got better, but his behavior really improved. And then they recommended fish oil. So I put him on fish oil, and that really calmed him down. Now, it didn't really change a lot of the things he could not do. Like, he still couldn't read and all that at that point. That came later. But it really, like, the approach that they gave me, it changed his behavior 180 degrees. And I'm not saying it's going to do that for everyone, but I'm just saying that's one of the approaches that could be taken. And we also worked with a naturopath to like figure out what was going on with him from like a vitamin deficiency standpoint, toxicities, things like this. Removed all of those out of his diet. He was still having some allergy issues though. And because of the time that we didn't know anything about what to do, his tonsils had gotten really huge, and they were actually choking off his airway. And so he got his tonsils out, but everything they gave him from an allergy med perspective just made him sicker and sicker, because a lot of times people on the spectrum, they're so sensitive to the additives in the medications that the additives in the medications actually affect them more than the medication can benefit them, because they have issues with detoxifying things. And so I had a friend who's an orthopedic surgeon, and he said, well, your son has all these allergies. Why don't you start him on this antioxidant that I'm giving my kids, because it's really helped them with their allergies. And it just had like pine bark and bilberry, which is an extract of blueberry, and citrus bioflavonoids, which are like a natural vitamin C. And so I'd already put my son on this diet. I'd put him on fish oil. I'd taken him to all this therapy. We had changed all of these things about our life. My husband was staying home. I gave him this antioxidant, and all of a sudden in 3 months, he went from like not recognizing letters to reading recipes and doing cooking, because he was always very interested in food. And so literally like his neurologic destiny changed by doing all these lifestyle things, changing his diet, putting him on fish oil, putting him on antioxidant. And then later on, we put him on some different other things, digestive enzymes and a special kind of B vitamin, because a lot of kids on the autism spectrum have issues with metabolizing B vitamins. And with that, he really, over time, he just got better and better and better. And then when he went through puberty, it was like a lot of things normalized for him. So now, if you met him, you would have to talk to him a long time to figure out that he has kind of narrow interests, and his interests are maybe a little bit younger than his age. Like he still likes dinosaurs and things like this. But he's going to college, he's making great grades in college. He's going to graduate from college. And so, his destiny was really changed from this kid who was rolling on the floor screaming, where we were told, like, yeah, this is what you can expect from him, to this person who's super productive in society. And so I just want to give moms hope that, don't give up on your kid. Like, get a lot of different opinions, look for other ways of helping them outside of the regular medical system, because there's not a whole lot for them in the regular medical system. Do get them the therapies and all that. But for my son, the therapies weren't really helping him, like speech and all that, until we could get his brain to a place where he could actually benefit from those therapies and get something out of those therapies. And so that's kind of the switch that really made the huge difference for him.
Wow.
And that I will agree with. My son, so like they just diagnosed him with autism, but he's been in speech therapy since he was like 1, because that's the first thing the doctor recommended versus getting him tested for autism. And in my honest opinion, and now, it's helping a little bit, but I feel like he's going to be for it. I feel like he should be, I don't think it's helping it that much, because I feel like he should be more advanced if it was, to be honest.
Yeah. So what I would encourage for you, Callie, is look for a functional medicine doc, a holistic doc that has a lot of experience with kids on the autism spectrum, who does the testing to figure out what could be up, who can give you some things that you can do from a brain perspective to really help your son. I'm not talking as a doctor here, because that's not my specialty. I'm talking as a mom who's gone through this. And, that would, if someone had told me this when my son was 2, I think I would have been really, really grateful to them. I just had no idea, and so I just happened to have a bunch of lucky things happen. And then I ended up, once my son really responded to this antioxidant, I was like, I got to do research. And I started doing a lot of research about it. And that's when, the internet had gotten to the point where you could just really easily research things. Because we're talking like the early 2000s at this point. And that's when I started really finding out, like, oh, there's all these different approaches for these kids that, are not really being discussed with me when I take them to the doctor's office. So
it seems like going a holistic, at least trying it for a lot of different things, work. So much better than a lot of these medications that they try to put people on a regular basis. Like, a lot of the medications have so many bad like side effects that it almost feels like you're worse off taking the medication than living with whatever condition, or if you have a disease, or if you have anything, you're worse off taking the medication. I know I've experienced being a type 2 diabetic. The first thing they want to do is give you metformin. And that is not an across the board type of thing that you can do to, get people healthy. A lot of times it's way more than that. It's deeper than that. And it's things that you can find in your own refrigerator. There's holistic approaches. So I really appreciate you bringing that aspect to it, because that, I think you being a doctor has a lot to do with how successful you've been, because not only did you advocate for your child, but you knew, you were in communication with other professionals and friends that were able to tell you, you know what, try this and try this. And so you were able to do that. What would you suggest? I mean, you gave her some tips already, but what would you suggest to someone like Callie, or even, someone that might be listening? They recently get a diagnosis for their child. Callie mentioned yesterday, I have a family member that mentioned recently they got the diagnosis. The waiting list for speech therapy or any other type of therapy is a year long or 6 months long. What are some of the things that you can do at home to kind of tackle some of that?
Yeah. So again, I mean, this isn't my area of expertise. I'm just the parent. I mean, medications have their place. I just think for my son, they do not have a place. But, I mean, if somebody's blood pressure is 200 over 120, I'm not going to give them herbs. I'm probably going to give them a medicine and then work on their lifestyle. But in this case, I mean, it wasn't the solution at all. And what I would say, Callie, is really, like I said, seek out a doctor who is holistic and really understands the autism spectrum. Ask around, do your research. I mean, the internet is so helpful now. It was not very helpful back in the early 2000s. But, it's so helpful now. I mean, you can find people, you can even find people in different places in the country that can do things for you remotely. But find somebody that can do the testing, get to the bottom of what's going on with your son, give you specific recommendations for him, but somebody who's experienced and ask around and make sure you have good recommendations too, because there's a lot of, I'll say maybe not so kosher people in the holistic space also. So you have to kind of do your homework and ask around and maybe form a community with other moms on the autism spectrum around you. Seek out people so that you can be of support to one another, because a lot of times people can't understand or take care of your kids because they don't know how to take care of a kid like that. But if you have other moms with special needs kids, they can actually be of support to you. My husband was very alone because he didn't, he felt kind of weird hanging out with a woman and her kids. So he actually was extremely alone a lot of the time. But, I think as a woman, actually, that's a little bit of an advantage. There's a lot more moms home still. So I would seek out, support. I would look at Defeat Autism Now, Dan, that organization. There's other organizations like Autism Speaks and all that raise money for autism research, but Dan actually talks about what you can do for your child now. And I would seek out a really good developmental pediatrician that, can make sure your diagnosis is correct. And, if they're holistic, that would be even so much greater. What state are you in, Callie?
I'm in Texas, San Antonio.
Oh, you're in Texas. Okay. Yeah. So I'm from Texas. So get in touch with me because I can make some recommendations for you.
Okay. Yes, ma'am.
Yeah.
I love this. This is exactly what this platform is about. Is being able to network. So I wanted to ask you, Dr. Emi, if when your son was younger, what were some of the difficulties he may have had at school as far as like did he experience bullying, anything like that? Did he experience that? And how did you help him kind of get through situations like that?
He was very isolated. He didn't really have bullying as such because he was more in the, special ed classrooms and all that. So he wasn't really bullied, but I think he was very isolated. He didn't have very many friends. He did end up having a couple of friends who were, also in special ed that were kind of also high functioning. So that was helpful for him. In high school, it was really kind of interesting. He's a very, very kind person and really empathic. So even though he's special needs, I think he still had a lot of friends, and he was actually elected homecoming king in high school.
Okay.
So, yeah. So, I think he just, thankfully that we're in a small community and people were very, very deferring to him, and he's kind of a big guy and a really strong guy. So I think that kind of kept people from bullying him too much. But I think that can be an issue for some kids for sure. But I think, that's the other thing is find community, find a school where your kid's going to get treated well. That's one of the really important things to do.
Did you have to change schools?
We did change schools, but only because of, where the best special ed teachers were in our community. So, yeah.
Okay. That makes I've had to do that before. With my oldest child, sometimes you may be zoned to a school that, they do zoning in Georgia. When I lived there, and sometimes you may be zoned to a school that is just not good for the needs of the child. And they would try to tell me like, oh, we think, she might need to be in a special ed class or go back a grade or, And I had to really advocate for her. And all it turned out to be, she was like a genius in math. She was like on a 5th grade level of math, but her reading was like 1st grade. And I
Mm-hmm.
think she was in the 2nd grade. So she was behind in her reading, but she was a genius in math.
Mm-hmm. Yeah.
All it really took was I needed to move her to a school that had more like a class that was smaller. You
Mm-hmm.
know, that she was in a class with 30 kids.
Yeah.
She couldn't thrive in a classroom setting like that. So I realized, you know, you do have to sometimes make sacrifices and changes when you realize that your child needs something. You I mean, we moved to a completely different area in the state just because of that reason, because it was important enough to me to not hold my child back a whole grade
Mm-hmm.
because they weren't able to figure out what she needs. So I commend you for that as well.
Yeah.
Um,
That's something you have to kind of keep a close eye on, figure out what's going on at school. It's not always easy.
yes, and that it's not easy when you don't have a child on the spectrum. I mean, I constantly have to talk to my daughter. Now
Mhm.
she's 9, and I'm constantly, okay, how's school? Are you making friends? Or you want to make sure that they're comfortable socially.
Mhm.
But they're still focusing on their work and that they're getting what they need. Like, I didn't realize my daughter couldn't see. Like she couldn't see far away. The teacher was
Mhm.
like, I think she might need glasses because she like the board just looked fuzzy to her during math class. So now that she has the glasses that she needs, she's thriving more. So you like that communication and communication with the teachers and everything is so important for every I feel like for every child. It's important regardless.
True.
Um so Miss Callie, I know you said that you have he has speech therapy today.
Yes.
How has that been? I mean, I know you probably just are starting this, being that his diagnosis has only been a month, correct?
Well, actually, that's what I was stating earlier. So, what the doctor did, pedi- they put him in speech therapy before they even considered
Got you.
testing him for autism. So, he's been in speech therapy.
Okay. And how has it been so far?
Excuse me. I feel like he's picked up some things, but for him to have been with her as long as he has, and it's not her fault or nothing because I believe she's watching. So please don't take this the wrong way. But it's I feel like he should be talking more, know more. So that's how I know it's deeper than just speech.
Right. Yeah. So more than likely, and Dr. Emmy probably can tell you more. And I would definitely recommend reaching out to Jen, our psychotherapist from the last episode. She's willing, to do a consultation with you. There's probably several other things that he needs right now, as far as things to, keep him calm. I know you said he screams a lot. So probably a lot of those things that he's experiencing is probably affecting how well his speech therapy is going. So I would definitely
Right.
recommend reaching out to Dr. Emmy and getting some of the resources that she's offering, as well as um, Jen has wonderful resources with the autism. I think it was Autism 360 support, the website that she has. She's offering free consultation. If there's some resources, she has free resources, reading material on her site that I think are really, really help, because what I've found in the research that I've been doing over the last several weeks in preparation for this show is that most parents are dealing with issues at home, what to do during the transition of I got the diagnosis, now what? Right. And that I think a lot of that'll get covered in our third part as well. Is,
Right.
what do you do in the time that you're waiting for therapy to kick in? Or what do you do in the time that you're waiting for him, to to he's having meltdowns at home, he's going through this, he's going through that. There's a lot of resources that these ladies can probably offer to you to kind of help address some of that. So hopefully his speech therapy will go a little bit smoother.
Yes. And like how she was saying earlier, like definitely like to like buy his my daughter My other son will try to play with him. He's not very much interested. Even at the daycare, they kind of let him do his own thing because he doesn't really bothered. And I noticed here recently, it seems like he's scared. Like he has a lot of fear. Like he doesn't really like people walking up on him. Really, he doesn't like that. So yeah, I'm definitely gonna do my research. I'm gonna figure it and get fully educated because it's very much all new to me. And I'll be honest, it's very overwhelming as well. Well, I just pay. Of course,
I can only imagine.
so,
I can
yeah.
only imagine. And that's why I wanted to do this, was to be able to kind of bridge that gap between people who kind of feel lost and don't know, it's overwhelming. There's so many questions, you kind of don't have an idea where to start. And if you're not getting what you need from the pediatrician, or they don't specialize in these particular areas, that might become problematic. Um,
And then on top of his speech therapy, which is at 11, he also has an appointment today. So I'm gonna just see what his doctor says. I'm gonna let them know. I'm on the waiting list, but nothing is available right now. So
Now,
I'm
is
gonna do.
that an insurance issue? Like you have to go to a specific place based on your insurance? Because I've heard
Uh,
that's a big
said
problem.
from what I've been hearing, no, it's not the insurance because I've even called places, who it's just all of them like a year, 6 months. And I've called multiple, multiple, multiple. The list was so long that they gave me, and I went down that list, and not one of them had availability right now.
Wow. Right. And I feel like that's a problem. And hopefully you'll be able to tune in to the episode that we're doing on Thursday, because
Oh
I
yes,
believe that our art therapist will have some excellent resources as well. Again, she can't work outside of her licensed state, but
right.
she can still tell you how to kind of look for what to look for. Um, Art therapy apparently has had huge success amongst autistic community, as well as grief. There's a whole anxiety. There's a whole. I probably need to see art therapist, girl. So it's a whole lot that art therapy can be used for. So I think that's going to be a really, really interesting component to this show, is to kind of see alternative ways to help. And a lot of psychotherapists and therapists will contract out with art therapists to aid in things like this and autism and everything. So I think you'll get a lot of information from the
Yeah,
next episode as well.
definitely. I'm so thankful for this series. Like yesterday was great. Today was very educational. So I just know Thursday is gonna be good too.
Yes. And then hopefully, guys, hopefully I'm gonna be able. Dr. M dropped off, but hopefully she'll be able to come back up. But I'm hoping to be able to confirm a fourth part. We're still trying to get and to get someone that's available to do the show that lives with autism, that's an adult and lives with autism. So I'll be announcing that probably on episode 3, whether or not we can get whether or not we can get that person on. So while we wait to see if Dr. Emmy is able to come back, let me go through some of the comments and questions. And if you have anything that you need to add, Miss Callie, feel free.
Okay.
And if you guys have any questions, go ahead and drop them in the chat. If you have any questions for Miss Callie while she's up here solo, now's a good time to go ahead and drop those in the chat. Words of encouragement, anyone that might have a child on the spectrum that might be able to offer words of encouragement to Miss Callie. It's a new diagnosis. She's trying to do everything she can to take the steps to get him the help he needs, and there's some roadblocks. So let's take a look and see what's in the chat. If there's any questions here in the chat, go ahead, Miss Callie. If you have anything you want to add.
No, I think Jeanette asked, was there a regional center in my state? I'm honestly not. I haven't heard about any, but I'm sure there is, but that hasn't been brought to my attention. So I definitely will do my research.
Okay. Pamela J says it would be great if schools could organize parent support groups inside the schools. That would be awesome. That would be awesome, if that was something that could be done, even if, parents could get together on their own and, support one another. And I wanted to ask you actually, Dr. Emmy, how important is, family support to, the development, like the changes that you guys had to go through as far as, I know you said you have an older son and a lot of attention had to be given to your younger son. So it
Mhm.
changed the family dynamic, I can only imagine. But how important was it to have the support of everyone in your family?
It was really important. Unfortunately, we had moved out here to Washington State from Texas, so it was just us. I mean, we were pretty isolated, but we happened to, meet an elderly couple in our church that kind of became like, surrogate grandparents, and they actually had a really good understanding of kids on the autism spectrum. They were super kind to my younger son. Always, took him hiking, taught him math. They were always there to, help us if we had an emergency, to babysit. I mean, it wasn't like, you know, your own parents where you can drop them off and go on date night. But if we had an emergency with our older son or something, they were always there to babysit. They were there to pick up the kids in a pinch. So that was really very important to have that kind of support. My whole family, though, was really supportive. Like if we went on vacations together, my mom's also a nutritionist. My sister, who I actually want to maybe hook up you with, in Texas there, she's actually a holistic allergy and immunology specialist. So they were all very on board. I mean, it was really nice to like go on family vacations, and, they made sure that my son had gluten-free and dairy-free desserts, and my sister would bake for him and, make sure that he didn't feel excluded. So I think that's super, super important. I think, sometimes even going to church can be really hard when you have a kid who's on the spectrum, because their behaviors are not always very familiar to people. So to have people be really understanding and make you feel welcome, I think is so important. So if you're in a faith community and there's kids, parents with kids on the autism spectrum, like reach out to them because they really need you. I mean, that's really one place where you can be of service is, reaching out to these parents and, helping them with whatever they need with their kids and making their kids feel welcome. We happen to have like a vacation Bible school right down the street from us that actually catered to kids on the autism spectrum, and they had gluten-free and dairy-free food. So they had a place for them to go that was, very accommodating, and they actually had counselors, and they had taught the other kids like how to behave. So like my kid would go to the pool, and there'd be like these kids from Vacation Bible School who are like, oh, hey, Vahid, and it just meant a lot. So I think, those are just little things that people can do in their communities for parents who are feeling really isolated and really have a hard time, going a lot of places. And so just be aware of that, be aware of what's going on with these parents, and try to be of support to them, because a lot of people we didn't have a lot of family around. And so our faith community was super, super important to us when it came to, helping us with our kids. Having my family on board for vacations was super important. So, if you're that family member, if you're that church member, just keep that in mind. And, I know before I had a kid on the autism spectrum, I wasn't really aware of that. And I really might have looked at a kid who was behaving weirdly, differently, instead of bringing up to the parent.
No, and that's a conversation my sister and I had recently, is that when you either know someone that has a child that's autistic, or you start doing research like myself, or you have a child that's autistic, you start to look at things very differently. Because how many times have we all, and I'm sure we're all guilty of it, have been in a grocery store or at a park or somewhere out in the street and seen a child, what we assume is misbehaving, acting out, or doing something completely off the wall, and we like, oh, not our child, not my, I had to tear him up, or
Right.
it'd be things like that, and we totally have absolutely no idea what that parent is actually dealing with in real time and in real life. So it makes me look at things different, because we just don't know.
Yeah, and that's something I typically, and it's not because I'm ashamed of him or nothing. It's just like it's hard when we go public places because he just screams a lot. Like restaurants is hard. Like just anywhere, like it just screams. Go sit down. Look, there he is right there. He said go sit.
He wanted to put his 2 cents in. So I have a question here from Twitch. Salute to everyone that's watching on Twitch. Do you think autism might be caused by ultrasounds or Tylenol? You hear that a lot these days, so I don't know if you're able to answer that, but
That's a
um,
good question.
you see it a lot on television. There, these class action suits, saying, is your child, suffering from autism? You might have a case because if you took Tylenol during this time, or vaccinations. Do you have any insight on that, Dr. Emmy? Oh, she may be on pause.
But I have seen, like how you said, I've seen a lot of commercials and ads about that, stating that.
I want to say salute to my chat. We got new people coming in. Willie, salute to you. Smoke to the Bone Barbecue, salute to you. Thanks for stopping by. I appreciate everybody that's taking the time to stop by and joining in this conversation. Jeanette Jackson, thank you for being here. Let's see if I can go back to any more questions. I'm so far behind on this chat. It's not even funny.
Salute, Smoke to the Bone. Kira, thank you. I'm definitely, trying to keep my head up, taking it one day at a time. I just want to, be able to take care of him properly. On top of me being a single mother with a 5-year-old, him, a 1-year-old, and a newborn. I have a 2-month-old, so it's been very much stressful.
You have your hands full.
Yes.
that in itself, just having 3 children. I salute everybody that has multiple children that are small. You have 3 kids under 5 and under. Listen, that's enough.
I have kids. My 5-year-old, him, which he's 3, me, my 1-year-old, and then my 2-month-old. So yeah.
Will, great comments here.
Willie, he likes a lot of, like, if it has music, that's him in the background, you guys, excuse me. But if it has like music, he's all for it. He likes any shows, any movies, as long as it has some type of singing or music in it.
I don't know. Dr. Emmy, can you hear us? I think she might still be on mute. She might have it completely muted. Let's see. Miss Cali. Surround yourself with positive people that can help you manage going forward. Stay strong. That's good. Most don't speak at all. I'm behind. I think you just read. Did you just read these?
Yes.
Okay. I'm behind. Journal when he has an episode and what you're doing and where you were when he was triggered. That's a good idea. And find ways to redirect his behavior in a positive way.
Yeah, I'm definitely going to start doing that.
Well, I know someone mentioned yesterday about having like different calming toys and things. There's websites that you can visit that will tell you the different types of calming toys or weighted blankets and different things that you can use to help in situations like that when they need to be calmed down. So I've been trying to do my research, girl. I'm done having kids, but autism has touched my family for years, and so being that it's Autism Awareness Month, I just wanted to make sure that we actually talked about it and got several different perspectives. Right. California has services that they don't advertise. I didn't learn about them until my kids were older. So I always tell people with younger kids about them. That's great. And see, this is what I love. People are being supportive of one another. You guys make sure you like, share, subscribe to the channel, share out this live. Make sure that you're prepared to tune in on Thursday for episode 3, the conclusion of our series, or possibly just the third part. We might have a fourth. Make sure you tune in on Thursday at 7 p.m. Eastern Time, that's 6 p.m. Central, to hear the conversation with Elizabeth Rose. She's our licensed creative art therapist, and she's going to be giving you the perspective from an art therapist on some different ways that um, children and even adults living with autism utilize art therapy, um, to help. And so I think it's going to be really, really great to hear what she has to say. Dr. Emi, are you there?
Yes, I am.
Okay. Someone asked a question a little while back, and I know this is not your field of you're not in this field medically, but I think a lot of people see these commercials about Tylenol and they, vaccinations, ultrasounds, and they were saying, do you think autism might be caused by these things?
I mean, there's really no evidence of that in the medical literature. I mean, there are definitely genetic issues that are linked to autism. Things like issues with detoxification, MTHFR, which is a genetic issue, is more common in kids on the autism spectrum. So there's definitely genetic issues. Now, whether those genetic issues make you more likely to have problems with toxins, or because you have issues with something called glutathione, could you be more sensitive to Tylenol? Yes, but that's not what caused that generally. So it may increase the risk if you take certain medications during pregnancy, but it's probably not the only cause. There's probably a genetic underlying issue that makes a kid more likely, because there's so many women who take Tylenol. Only a minority of them have kids on the autism spectrum. It's becoming more and more common, but really you want to be careful about making those causal links, and it's not my expertise, but I do know from what I've read, that there are biochemical differences in kids on the autism spectrum. Like I was talking about, lower glutathione levels in their red blood cells. Glutathione is something that helps with detoxification. Issues with MTHFR are more common. That's a gene that has to do with B vitamin processing, again, affects detoxification. So could they be more susceptible to toxins and certain things? Certainly. But is it the whole picture? Probably not.
All right. Well, I mean, that was a great answer. And I didn't think I think I was hearing that it's very unlikely that any of those things cause it, that it's genetics.
Mm-hmm. It's a genetic. Now, anything is a amalgam of genetics and environment. I mean, the genetics for autism have always been around. The incidence is increasing. There's some arguments that it's just being recognized more. I do think it's increasing. A lot of docs, a lot of teachers rather, who have been in the business for a long time have told me, no, it's not just that it's being recognized more. The number of these kids is increasing. So I think that's probably true. And our genetics haven't changed that much. Our environment has changed, but to say it's one thing, I don't think it's one thing. I think it's just there's so many things that could be affecting someone who has issues detoxifying.
Okay. So I want to transition quickly before we end this live. I got a couple more questions for you. Let's switch over to your son. Now he's an adult. He's about to graduate from college. How was that transition, not only for him, from being an adolescent with autism to being a young adult with autism? What was that transition like for him? And what was it like for you to have to kind of see him off to school? And how, I know there's a lot of anxiety just as a parent, period, to let the kids fly the nest. But how was that for you?
Yeah. So, it was slower than it is for most kids, because he lived with us the first 2 years of college. When he went to community college kind of near us, they had a lot of programs in his community college to support him. So that was really, really helpful. They actually helped him apply to the University of Washington. So I had nothing to do with like his application there. I just, he got his letter that he got in. And then he, had to move there, which thankfully is just an hour away. It's one of the #1 fisheries biology programs in the country. That's what he's studying. So it was just, it was kind of neat actually. And the first year it was a little bit, it was a little bit difficult to see him going off. But he had learned to drive and everything like that. You know, he cooks for himself. He cooks better than most of us do. So I knew he'd be okay. We leased him an apartment that's like within basically walking distance of the university. So all he has to do is walk to class. You know, there's Trader Joe's and right there, right across the street, PCC, which is another really good health food store, is just a bus ride away. So he's pretty set. We have a really good situation, but he's very, very sharp. One thing that he did in high school that I think really helped him, and I think if you have a kid like this, like really push them in safe environments to push their limits. So he traveled a lot with these two teachers that were really great at going on. You know, they went all over the world. They went to the Panama Canal. They went to, this turtle sanctuary in Costa Rica. They went to Europe. And in preparation for going to all these places, they taught them like how to navigate public transport. So my son's like awesome at navigating public transport. He could show me a thing or two, you know. So he had these experiences that kind of prepared him. And that's one of the things that you really want to do as a parent, is really push them to do those experiences. And gosh, the teachers loved having him because people on the autism spectrum tend to really follow rules. So they always wanted him on these trips. They knew he wouldn't be going out and partying or drinking or whatever. So he was really well prepared because of these other experiences that he'd had. You know, once he moved out on his own, he likes the time alone. He likes cooking. He posts these amazing foods that he makes on Facebook, you know, and I mean, it's been awesome. You know, it's hard for me now being an empty nester, one kid in the Marines and one off in college, about to go to work, but it's awesome. I never thought I would see this day, you know, when he was like a 6-year-old rolling on the floor and screaming, for sure. So
see, and that right there lets me know that there's so much, there's hope in every situation. And I think
absolutely,
that leads me into the whole thing about the common misconceptions about people with autism. Oftentimes people with autism are brilliant. You know, they are very successful at whatever it is that they set out to do. We have a lot of historians and famous celebrities that live every day with autism, and they produce great movies. We have inventors, all types of people. What are some of the common misconceptions that people have about people with autism?
Well, I think one of them is like, that they're not honest or something like that, because a lot of times people on the autism spectrum have trouble looking you in the eye. There's actually a really good book by a man with high functioning autism, John Elder Robinson, and it's called Look Me in the Eye. So like, for instance, a lot of times when people on the autism spectrum get, questioned by police and stuff, they think they're lying because they won't look the person in the eye. So that's one thing, is like, it's not that they're dishonest. They have trouble like focusing on a person's face. It's too much for them. So they kind of look away. So that's one thing. Another is that they're not smart, like you were saying, and a lot of them are brilliant. They just have a different way of interacting with the world. Some people think that, people on the autism spectrum don't have empathy. I think that's totally wrong. Like, my son has tons of empathy for people. He's very, very sensitive, very, very caring about people, really honors every person. So I think a lot of that just has to do with upbringing and, nature and nurture. So I think those are some of the common misconceptions. Others is that they're not fun to be around. And in fact, I think they're so fun to be around because they have such a different perspective on the world. They see things in a very different way. They see every situation kind of out of the box, and they're just wonderful people to be friends with. They tend to actually be extremely honest. So, a lot of times they don't filter what they're saying, and so people can be offended. But really, I mean, I find that very refreshing. So, yeah.
Actually, so do I.
Yeah.
So do I. Miss Cali, did you have any specific questions that you wanted to ask Dr. Emi?
No, I think the chat and she already kind of covered it. Just like, basically, just for me, I just need to work on my patience because I do get overwhelmed a lot. That was my whole concern. Like, with me just finding this out and being new to all of this, so just, it's something I got to work on as well, not just on his behalf.
Yeah, it's totally understandable. Dr. Emi, did you have a like a self-care routine for yourself in the beginning, when you got the diagnosis and you had to kind of figure out, so much had to be poured into balancing raising both of your children and giving the
Yes.
special attention to him? What was your self-care process like?
Back then it was really bad, which is how I got to be 100 pounds overweight. I'm kind of known as the doctor who lost 100 pounds. And the way I got to be 100 pounds overweight was all that stress, Callie. So I can just tell you, like, don't do what I did. Do
No.
put yourself first, do eat nutritiously, do find the time to exercise, most importantly, all of that. I do that now that my kids are older. But yeah, I really didn't do it when I was younger, unfortunately.
So what are your plans now that you're gonna be an empty nester? Like, are you gonna be traveling more? What do you see? Because you've poured so, and I mean, it's gonna continue. You're gonna always pour into your children, but
Yeah.
do you have any plans to do anything that you haven't had the opportunity to do yet?
I have a lot of places I want to go on my bucket list. So maybe, I'll be going to like the Seychelles or one of those places. Yeah.
Sounds fun. Yeah.
Yeah.
I mean, you definitely deserve it. I think that you have been a wealth of knowledge for us today. I know I learned a lot just speaking to you the other day, and then again having you here on the panel. And I'm just hoping that the chat walks away feeling like they've gained something, and especially Miss Callie.
Mhm.
Like I said, I was taken to her story when I heard it, and I was like, oh, she needs to
Absolutely.
come over, and then at the time I hadn't had you booked, but I was like, my goal is to get her on panel with someone who
Yeah. And if you can pass along my contact info to Miss Callie,
I
Miss Callie, I'd
definitely
love to
will.
talk. Yeah, for sure.
I
So
definitely
much. I appreciate both of you. I really do.
Yeah, for sure.
And so please don't let this be the last time you visit the show. I do a lot of shows, not just on awareness, but I like to do shows where I interview people with, unique stories or unique professions. Or I think what you're doing with the nutrition, that's something we really need. That's something that I struggle with, especially eating well on the road. Like I'm getting on the road in a couple of hours, and it's
Hmm.
so easy to pull over at McDonald's and grab that crappy burger,
It
you
is.
know,
Yeah, it
and
is.
instead of getting, a nice, good, hearty salad, and those are things that I like. So,
Hmm.
nutrition is really important. Not only did you prove that it was important for your son, in dealing with autism, but like
Yeah.
I said before, I feel like nutrition is key with almost every medical diagnosis that's out there, changing the way you do it, adding healthier food.
Absolutely.
Like I really would love to have you come back and talk about your practice. Are you private
Yeah.
practice or do you work with in
I do private practice. I help people lose weight, usually a significant amount of weight, and not just lose weight, but really lose fat, gain muscle. And my philosophy is if you're going to do that, you want to look more beautiful on the other side. So I really help people support their hair, skin, nails, so that they emerge from their journey like looking more beautiful, feeling more energetic. Maybe leaving behind some of their prescription drugs because now they're healthy. So that's really my aim, is not to just help people lose weight, but really like turn their life around. And especially for those of us in the middle age where it's so challenging, really, to really get to the bottom of the issues that are plaguing us and fix those. So yeah.
Well, thank you so much again. I
Yeah.
appreciate you
Thank you
for
so much.
taking time out of your busy schedule to be here with us. I know you fit us in between patients. Like I'm forever indebted to you for being here with us today.
Thank you so much for
Please don't
having me.
be a stranger to the show. We definitely got to have you back.
Yeah, I'd love to be back. Thank you.
Thank you.
Thank you so much for all your great advice. I definitely soaked all of it in. You are very much a help for me today. So
And I will make sure that I share your information with Miss Callie. And I'll put it up in the I actually should have had it up there. Your I can put your IG up in in the chat. But again, thank you so much, Dr. Emi, for being here. And we'll see you again soon, hopefully. You're on mute.
Absolutely. Thank you so much for having me.
All right. Have a great day. Miss Cali, Miss Cali.
Hey,
I want
again,
to thank you so much for coming by. The Fresh
no,
Perspective.
thank you
Like I
for
said,
having.
I saw you on Miss Parker. I was like, oh, I gotta have her over to the show. I'm gonna, and I delayed. It was delayed by like a week and a half. Um,
Yeah,
but I reached out to you on IG, and you were like, I totally want to come and tell my story. And we're with you. You know,
yes, I appreciate everybody in chat. And I see Miss Parker in here. Thank you, sis, for
salute, Miss Parker.
hooking me up with Lady Fresh because this was very much helpful. I've sat on the phone with Miss Parker, so she hears a lot of what I'm saying as far as my 3-year-old. But yes, thank you to her because
I love
we.
Miss Parker. She
Oh,
is like one of the sweetest people
oh
ever.
yes,
Her content is positive. I heard back in the day though, she was the scratch queen. You mess with her
oh
back
yeah.
in the day.
She didn't play no games. But she's a person. She always gives great advice. She's always trying to connect me with great people. Tries to keep my head on straight because I'm hard headed a little bit.
Aren't
So
we
yeah.
all though? Aren't we all? Aren't we all though? But this is a place of peace and positivity. We are often trying to bring awareness to so many different things. And so, we're definitely not going to stop here.
Okay.
But before I go, I just wanted to share with some of you guys some of the celebrities and historians that are autistic.
Oh
Um,
wow. Okay.
so, and some people may be familiar that some of these people are autistic, but I suspect that most people have no idea. So, this will debunk a lot of the common misconceptions that people with autism are anything less than anyone else. They're actually sometimes way more brilliant than people who are considered normal. So, we have Albert Einstein was autistic, and he's like the greatest mind ever to exist. Dan Aykroyd, the actor, the actress Daryl Hannah, Charles Darwin, Sir Isaac Newton, the actor Anthony Hopkins, Michelangelo. I mean, come on, you've seen what he's painted.
Wow.
Revered. These are all people who are on the spectrum. Bill Gates, come on, one of the most wealthy people in the world. Courtney Love, Mozart, Steve Jobs. So you got Microsoft and Apple, both men on the spectrum. And we'll get into more of these in the next episode, but we also have actor Jerry Seinfeld. So that goes to show you that you don't have to live under any label. You don't. You just got to figure out how it all works. And hopefully, this show can help with at least having the conversation and trying to understand and being more accepting of the people on the autism spectrum. Again, Miss Cali, thank you so much for being here. I appreciate you being my guest. Don't be a stranger.
Rock bottle on the track, boy. Yeah. Lady Fresh, keep it real, and that's a fact. She gon' tell it like it is, that's just that on that. Yeah. That's just that on that. This the Fresh Perspective with Lady Fresh. Lady Fresh, keep it real, and that's a fact. She gon' tell it like it is, that's just that.